coming to speak about the importance of psychosocial support for hemolytic anemias.
Assalamu alaikum. I would like to thank Dr. Amal Bishlawi, of course, for forcing us to come. And actually, I would like to start with a subject which is not it's not in the common of the what we hear. I would like to talk about the psychosocial support. Psychosocial support is ignored in most of the centers where they are dealing with thalassemia. I will try to cover most of these things in the next 15 minutes. Why we are talking about psychosocial support in hemoglobinopathies in general? It is chronic. It is a chronic disease, a chronic disorder. It drains the resources of the nation, socially, financially, and medically. What is the definition of psychosocial? What is the I like this definition. I don't know from where I got it, but in general, this is a definition of what is psychosocial support means. It's a scale of care and support which influences both the individual and the social environment in which people live, and ranges from care and support offered by caregivers, family members, friends, neighbors, teachers, health workers, and community members on a daily basis, but also extend to care and support offered by specialized psychosocial and social services. Why do we need this psychosocial support? The chronic disease in general, that means that child born with the disease and he will live with it all the stages of his life. Every genetic disease, regardless of its etiology, implies a sense of guilt that may interfere with the primary parents-infant relationship, help patients and families to face up the difficult demand on treatment, which maintaining a positive role. The target group for psychosocial services, we are targeting the patients, the parents or the families of these patients, community services, which health education, prevention services, awareness, and rehabilitative services for patients and families like job opportunities, fundraising, blood donation, which usually here in Egypt, you are not living with the same feeling of what does mean psychosocial support, at the value of the psychosocial support when you are living in a country which is not your country. There is like a milestone for the psychosocial support, which I believe in, that a lot of stages they need the psychosocial support. Before marriage, there is a psychosocial support. Infancy and childhood, parents and school workers. We saw before, 25, 30 years back, we met school teachers that they kept the thalassemia patients sitting away because they are afraid of the infection. Adult and teenage, the patient himself and the friends of the patient. Middle age, community, social, society, and marriage. Now we would like to talk about the geriatric age of group of these patients, which they are growing up, and we don't know how to deal with them, even in their diseases. When they are getting any infection, any disease, we are still don't know how to deal with them. They are 40 years old, but we don't know how to deal with them. Is it the 40 or the 50 or the 60 years old. After death is very important, because if the patient had a brother or a sister and he lost one of them, there is a problem with this patient, need psychosocial support, and the other friends, the parents, a lot of group which need the support. What is what is required from health professional psychosocial support? Who can be labeled as psychosocial support? The person must be open-minded, trained in psychosocial development from childhood to adulthood, sensitized to special issue of this chronic hereditary disease, available to accompany and support the patient throughout his or her life path. What is required from the healthcare system? The rotation of experienced professionals can seriously undermine patients' psychological well-being, treatment, and prognosis. Appropriate psychosocial support requires motivated and abled clinician, organizational structure that allowed health professionals to provide proper services, successful delivery of optimal and comprehensive care. We are doing counseling for these patients in most of the angles, which is premarital screening. We are doing psychosocial support, and we are doing a lot of support for them before they get married. Parents with the newly diagnosed cases, we are doing family support. Families related to thalassemia patients, regular blood transfusion, how to start it, when to start it. To start inoculation, so we are doing counseling for them, and we do psychosocial support for them. Compliance for treatment, they need the psychosocial support. Prenatal screening, and before going to bone marrow transplant, PGD, and parents, partners of psychosocial support. Partners of psychosocial support, it's coming with social workers, doctors, nurses, administrators, media, private sector, government department. It's all needed to support the patients and the families. We have Dubai Thalassemia Center is considered like a center of excellence in the service, type of service offered there. So continuity of providing a care regardless the age in one place. So we have when it is 6 months old till 60 years old, merging the patients in community so they are productive, not consuming only. The use of patients in awareness and education program. So we are trying to keep the thalassemia patients busy and working productive, not consuming only. I would like to go through some like, for example, we are doing some fundraising to support the patients. We found that the patients, you are giving medication for the patient, and then you are watching the patients to comply with this medication. And then you will find that the patient's telling that I'm taking the medicine, but he is not. So we did a lot of programs, we tried a lot of methods to improve this thing, and we found that when we are taking them, we took them abroad, outside the country, we took them and traveled outside, and then these patients changed totally. So we do the fundraising, we are not depending on any government or anybody. In Thalassemia Center in Dubai, we have so we have in our center, actually we started with taking thalassemia patients to work in Thalassemia Center. We have a lot of patients working in Thalassemia Center. We are looking for job for these patients, for our patients. We are going to meet the private and government sectors. We are trying to find them the opportunity to join them, to work with them. We create something called Roundtable Discussion, which we have, it's almost once a week. We are doing a roundtable discussion. We are getting the parents of all the patients and sitting, and the patients themselves, and sitting discussing all the issues related to them. We are talking about on their mentality. We are talking about their issues themselves. So they are talking about the things they want. They want to change the food menu. They want to change the method of dealing with how to come, where to come. All of these things we are discussing. Anything they want. So we are ahead, a little bit ahead with the managing the thalassemia patients in a different angle rather than the medical point of view. We are just exceed the medical point of view, and now we are talking about the psychosocial. That's why we are trying to be more patients and family rights. Patients and family rights is one of the major issues for us, actually. It is taken care by the center staff. This is one of the travel. We took some of the patients abroad. We are taking them to attend conferences, to enjoy, to we have actually, like Dr. Saad is mentioning, that we have our endocrinology clinic, we have the fertility clinic, we have psychiatrists, we have almost everybody is in the same center. They are coming to the patients. We have the same building, the patients living in that building, they are part of the building, and the doctors coming for them in the same building, actually. This is our recreation area for the patient. We are related also for the making a wish for these patients. Whatever they are wishing, we are trying to fulfill their wishing. This is one of the families request a car actually to come to the center, and we got them the car. And there's a lot of activities. We are keeping also in our mind always to trace the satisfaction, the patient satisfaction, the patient's awareness, the staff satisfaction. Staff satisfaction is very important. So we found that if we are losing the doctors from working there, so we are looking for the staff satisfaction, and we improve the satisfaction of the staff as much as possible to retain them in the center, actually. We are getting a lot of appreciation and excellence awards. We are doing a lot of activities, even the center is doing a lot of activities outside the center, inside the center. This is part of the social activities in the center which we have. We took them to Italy. Every year we are taking them to Italy. We are taking a number of the patients to Italy, to Dynamo Camp there. This is in Italy also. This is, for example, this Mother's Day. We exceed the Mother's Day, and we are concentrating on the thalassemia patients' mothers. The patients, they become mothers, and now we are taking care of them. We are appreciating them. We are supporting them. This is appreciation of the employees, actually. So the employees try to stay as much as possible with us. So all the patients coming to us. What I'm trying to say here is that psychosocial support is very, very needy, very important, very, very important for the patients and for the people working with the patients. I hope that not to forget them and keep in mind that thalassemia patients are getting old and we need some geriatric program for them to take care of them as soon as possible. So this is Giuliano. This is, thank you.
Thank you, Professor Assam, for the comprehensive talk about the psychosocial aspect of your care. You have mentioned a lot of great things. What was the most valued by your patients? The part of the psychosocial aspect that your patients valued the most?
It is variable, actually. When you start psychosocial support for the patients when they are in the teen age, it is different than the psychosocial support which you are giving when they are getting old enough, 30 years old. So the value, it is different as per the age. So in each age there is a value, and in each age we are finding a psychosocial need for this patient, and we are touching this part.
Let's speak about the adolescent thalassemia. What was most valued for them from the psychosocial aspect of your practice?
What I feel that they got this job, they got their productivity, they become part of the community, they are married, they get their children, they are working, they have their own houses. So it is a completely different story for the thalassemia patients there. We are looking now for the patients to be part of the community. He is coming. We have like a judge. He is a judge and he's coming to take blood. He's coming with his wife. We are preparing a place for him to stay with his wife. Sometimes his children coming with them. So we are creating a different mentality of handling the patients, not only to give blood and to treat, to check, to do. It is a different story which we are living with now.
Okay, thank you very much, Professor Assam.